1970 to 1980, before the stupid thing with the cheek and stuff, I was the man. And all the old plastic surgeons, they wanted me dead. And all of a sudden, me, it's a wonderful idea. Maybe having surgery in the office isn't such a bad idea. Because before that, they had stopped doing it, and they called me the butcher of Beverly Hills. Not the patients, the other plastic surgeons.
What means exactly? Can you clarify that concept of having surgery in the office?
Okay.
What does that mean?
Okay. Very easy. It means exactly what it says. I was in the Air Force till 1966. I was board certified, and I went to work with a man named John Williams. Interesting guy. I think he's still alive. Married 8 times. And I noticed that he was doing surgery in the office setting, not going to the hospital, giving Valium to somebody, and then doing noses, doing this, doing that, and local. Well, everybody knew that their dentists always was doing it, and as I later found out, people were doing it in the 20s and the 30s. When plastic surgery became organized, they went to the hospital as nobody. So I watched him do a case or two, and I said, let me do the anesthesia. You don't know how to do it. And with me doing the anesthesia, I was very good at doing something called twilight sleep. That's how babies came about in the 60s. It was a combination of, now it was Valium, before Thorazine, scopolamine, atropine. It was a cocktail. And I learned how to do it, and I could put the medicine in such a way, and then start to put the local anesthesia in, so that I could have 2 hours of a person asleep. And in 2 hours I could do everything that I had to do. I mean, I wouldn't, no, I probably, at that time I was delusional. I thought I could do everything. So, I broke up with this man who cheated me. He just stole, did all sorts of things. And Kathy came in my life, and I had been trained in Beverly Hills, and his office was in Inglewood, which was black, and I saw that it was going to turn black. And I said, I don't want to be. And so I designed an office for him that we were going to go. He wanted to go to Beverly Hills or Century City. So in November, I started with him in July. In November, it was already finished. And I was getting serious with Kathy. And I figured, screw it, I'm going to have my own office. And you know what I'm going to do? I'm going to put in an operator. And I'm going to run it. So I really made the first functional plastic surgery operating room that in 25, 30 years. And people say, hey, you can go to Wagner, you don't have to go to the hospital. I never liked the hospital. Number one, there are always sick people there. And plastic surgery patients, cosmetic, aren't sick. And for instance, a nose job took me 30 minutes. A breast augmentation. Oh, and incidentally, somewhere along the way, I was very well known for breast augmentation already. And that's what pissed a lot of other people off. What the hell is this guy? And there was a time when I was doing more breast augmentations than anybody. But I loved to do the surgery in my office. Number one, we could go faster, 1, 2, 3. Number two, that's all I could think about. And I saw that I was in real control. In retrospect, maybe I took a chance. And the chance that I took was predicated my real ability to do the anesthesia in such a way. I didn't just do the anesthesia. I had a nurse watching the blood pressure and things like that. And I got so good at it, so good at it. And in the meanwhile, boom, First Extreme Makeover, Look magazine, a book, and it just exploded. So if I'm supposed to be remembered for some things, from my point of view, yeah, I invented, I designed this, I designed a little this, I was pretty good at designing things, but that was the rebirth of all the surgery. Now it's interesting, every plastic surgeon now has his own surgical procedure in his office. Now, they even designed the Plastic Surgery Society, made a committee to go and examine the operating rooms to make sure that they're okay. How many times do you think they came into my office and checked me out? First of all, I wouldn't let them. I said, "Who are you to tell me I did it?" And then in 1975, I'd done maybe 7,000 cases in my office without an anesthesiologist. There was some problem, malpractice, and the head of anesthesia in one of the hospitals, because I would still go for bigger cases to the hospital, said, I'd work for you. If you can guarantee me $65,000 a year, I'm your man. I used to work in the dentist's office. I know how you do everything. I said, well, sure. Well, let's see how it works. Well, he stayed for 20-odd years, number one. And number two, the first year he took home $225,000. But I could then increase my output because he was there watching. So, and I taught a girl to put in the last stitch. See, for me, plastic surgery is a design. It's very much like being a dress designer. There are things you have to do yourself. The nose you have to do yourself. But if you do a facelift, for instance, you do the inside work yourself. You do the push, and you cut away the extra skin, and you put the basting stitch in. And it's no different than the dress designer who pins the dress and then says Juanita, Eduardo, or whoever the best sewer. And very honestly, one or two of my girls sewed better than I did.